Hello, my name is Andreea Varga and I'm a third-year student at Cluj School of Public Health, College of Political, Administrative and Communication Sciences, Babeș-Bolyai University Cluj-Napoca, Romania. And today I'm going to talk to you about pathways to healthcare for pregnant women from rural disadvantaged communities in Cluj County, Romania, a stakeholder's perspective. In Romania, in 2010, 78% of the mothers underutilized prenatal healthcare services, and those who did so were likely to live in a rural area, to have low socioeconomic status and low levels of education, to be member of an ethnic minority, and to be young. Qualitative studies have been conducted in an effort to better grasp Roma women's health from their own perspective, and qualitative studies involving stakeholders only explored their perspectives on Roma's health in general. Thus, the aim of this study is to explore stakeholders' perspective on rural Roma women's behavior of accessing healthcare services during pregnancy and to identify barriers and facilitators in accessing these services. Data was initially collected for a phenomenological qualitative study, from which 7 interviews were selected and a secondary data analysis was performed. The interviews were conducted face-to-face using a semi-structured interview guide with 2 community workers, 1 representative of a non-governmental organization, 1 representative of a public authority, and 3 healthcare workers. All respondents have expertise in working with disadvantaged and rural communities and/or with Roma women specifically. 4 interviews were conducted in English and 3 in Romanian. After obtaining the participants' informed consent, all interviews were audio recorded, later transcribed verbatim, and the ones in Romanian translated. Data was analyzed thematically using NVivo 11. The stakeholders have identified low rates of accessing healthcare services during pregnancy among disadvantaged women in general, but among Roma women as well. While in the communities where a health mediator was present, the community workers identified higher rates. And the representative of the public authority interviewed acknowledged the benefits of having a health mediator. And I quote, "We are very lucky that we have the health mediator who performs the role of family physician. She is the one who goes there, who visits the pregnant women, makes the appointments, takes them to the physician, and then they are received. But I don't believe that's enough." End quote. The perspective of 2 healthcare workers and the representative of the NGO on why Roma women do not access prenatal healthcare services is that, and I quote, "They consider that the pregnancy is something natural and they don't have to investigate something during pregnancy." End quote. But there are other barriers that have been identified, such as the physical placement of the specialized healthcare facilities, financial barriers related to unemployment and lack of health insurance, and social barriers related to discrimination from healthcare staff and avoidance coping mechanisms on part of the Roma women. From a legal standpoint, all pregnant women are entitled to health insurance in Romania, and in the communities where a health mediator was present, efforts were made to overcome barriers such as lack of IDs and low levels of health literacy. So it can be said that health mediators represent major facilitators for Roma women accessing healthcare services during pregnancy. In conclusion, low rates of accessing healthcare during pregnancy can be seen in disadvantaged populations in general, which point to structural barriers that could be tackled. For Roma communities, the health mediation program brought new pathways to healthcare for pregnant women, and not only. A limitation of the study consists of the fact that some interviewees responded in a language that was not their first language. They might have provided more comprehensive information if they would have responded in their first language. Understanding how and why women coming from disadvantaged communities access or not healthcare services during pregnancy from a stakeholder's perspective is one side of the story. Thus, future research calls for the perspective of women from such communities on their own pregnancy experiences. And having these views in mind, future policies and programs could be developed in order to increase healthcare services utilization for pregnant women from rural disadvantaged communities.